Welcome to my channel Natural. Eyes are not just a window to your soul, they are also a window to your physical health, as changes in your eyes can indicate vision problems, diabetes, stress, or even a retinal detachment, and what's more, most of these changes you can see on your own, assuming you know what to look for. And in this article we talk to Natasha Hers, Ph.D. and clinical spokeswoman at the American Academy of Ophthalmology, about what your eyes reveal about your health, and how you know that it is time to visit your doctor, where you reveal the eye reported a group of diseases and health problems. Your eyes reveal diseases. 1. Eye infection. Do you wear contact lenses instead of glasses? Beware of white spots on the cornea, as these white spots mean the presence of inflammation in the cornea, and it is very common among people who wear contact lenses, which may lead to corneal opacity and vision loss if not treated properly and quickly. 2. Anxiety and extreme stress. Excessive pressure can appear in a number of ways, one of which is a bleeding eye, and this symptom is very alarming, but it can be a sign that you need more rest, and manage your stress levels and stress. 3. Diabetes. Blurred vision may mean that you need glasses, but in all cases you must undergo a medical examination to rule out serious causes that cause blurred vision, as this pathology may occur either because of a medical problem in the eye itself, such as cataracts or macular degeneration, or it may be a sign of a more serious disease such as diabetes, as a study conducted in August 2014 found that 73% of diabetic patients who were sampled reported that they suffer from blurred vision, and an ophthalmologist may be able to discover a disease diabetes during an eye exam based on changes in the retina. 4. High cholesterol. If you notice a white ring forming around the cornea, it may be time to visit your ophthalmologist as well as your GP for a medical examination. This change, although in most cases it may be a sign of aging, it can also be an indication of high cholesterol and triglycerides, which may mean an increased risk of heart attack or stroke. 5. High blood pressure. In addition to increasing the risk of heart disease and strokes, untreated high blood pressure can also damage the blood vessels in the retina, known as high blood pressure retinopathy, and you cannot see the effects in the mirror, but an ophthalmologist will be able to detect damage during an eye examination. This indicates the importance of adhering to the annual checkups, noting that controlling high blood pressure can save your life and your eyes. 6. Eye sensitivity. If you suffer from allergies, your eyes may be very dry, and you rub them unconsciously a lot, and your eyes rub hard, which causes the eyelid to tear and move it away from the eye, which allows the eyes to be exposed to air, and makes them dry more than necessary, and seasonal allergies are one of the most common causes common for itchy eyes. 7. Detachment or rupture of the retina. Do you know those little spots that sometimes move in your field of vision? These spots, called flies or eye floaters, are a relatively common problem, but they should not be neglected, especially when there is a sudden increase in the number of floaters, which may be a sign of a tear or retinal detachment. 8. The need for more sleep. If you notice that your eyes are swollen and red, do not assume that you have an infection, as this may be just a sign of tiredness, in which case you feel tingling, and the eyes will become more glowing and red. 9. Exposure to too much sun. Some people develop the yellow patch on the white of the eye besides the iris of the eye, and it is called pingecula, and there is a very small percentage of these cases may turn into cancer, and these cases occur due to exposure to the sun and ultraviolet rays, and wearing certain lenses may protect the eye from radiation damage, so from talking to your doctor is essential if you start seeing these spots. 10. Jaundice. If the whites of the eyes are yellow like an old paper, this is an important warning that there is definitely something wrong with your body, and the yellowing of the whites of the eyes means that the person suffers from jaundice, and yellow means an increase in bilirubin, a yellow compound formed as a result of the breakdown of red blood cells, and if the liver has to filter this substance, the bilirubin builds up and can cause the eyes and skin to turn yellow, and this may often be due to an infection, such as hepatitis, alcohol-related liver disease, blockage of the bile ducts with gallstones or cancer. 11. Spending a lot of time on the computer. Being in front of screens strains your eyes, which leads to dry eyes and rupture of eye hairs, and this is very common among people who spend most of their day looking at a computer screen or TV screen. 12. Eyes too tired. Exploding blood vessels in the white of the eye may seem alarming, but most of the time it is just an indication that your eyes are working more hours than necessary, and the cause is most likely a cough or tension. And although the eyes look red and terrible, however, it is not harmful and does not indicate the presence of eye disease. Please subscribe and like and comment.